I think ADHD is a catch-all diagnosis. I think that people who are extroverted and unconscientious, for example, often manifest the traits of attention deficit disorder. I know that there isn't any real evidence of long-term utility in psychopharmacological treatment for ADHD. I would say, though, if you are having a hard time concentrating on your goals, that what you should probably do is set yourself up with a therapist. Find someone you can talk to, so see 2 or 3 therapists. I know it's expensive, but so is not having a life. Find someone you can talk to, and then make it, and someone practical, probably a behavioral therapist would be best, and then have them set goals with you and help you strategize to stay on track week to week. That's the best thing, or to set that up with a friend if you can't do it with a therapist. So that's the best.
ADHD is considered a neurodevelopmental disorder. The majority of people who get a diagnosis of ADHD get it early on in their lives. Given the nature of ADHD, this makes sense as the disorder is mainly an inherited 1-70% genetic component, with environmental factors playing a minor role. Some clinicians believe that ADHD is a scam. Dr. Jordan Peterson was asked if he thought ADHD was overdiagnosed and overprescribed for. He suggests that many people who have been diagnosed with ADHD don't have the disorder. These symptoms could be viewed through the lens of personality. His justification was that people with ADHD are usually known to be creative and imaginative. This is high in openness component. They also have trouble with focus and order. This is low in the conscientiousness component.
Attention deficit disorder overlaps with childhood conduct disorder and antisocial behavior. And I'm not saying that all children diagnosed with hyperactivity are conduct disordered. I'm saying that more aggressive boys tend to manifest symptoms that sometimes tilt them towards juvenile criminality and sometimes tilt them towards attention deficit disorder and hyperactivity. But it's partly their somewhat rebellious temperament. And so if you're disagreeable and extroverted and creative, well, then why wouldn't you be hyperactive? And so amphetamines were first used to treat hyperactivity. The hypothesis was the following. Kids who are hyperactive or attention deficit disordered are of a different neurological type. First of all, it's definitely overdiagnosed. Second, it's a very unreliable psychiatric diagnosis. Many psychiatric diagnoses are unreliable, and that's because psychiatric diagnoses aren't precisely scientific categories. They're weird hybrids, right? First of all, psychiatrists aren't scientists, they're engineers. Engineers are trying to do something rather than to describe the objective world, and psychiatrists are trying to make people healthy, whatever that means. It's actually partly ethical. It's very complicated. We don't know how to distinguish it from temperamental variation. So for example, if you're high in openness and high in extroversion and low in conscientiousness, low in agreeableness, conscientiousness, and high in neuroticism, you're likely to manifest symptoms of ADHD. It's because you're exploratory, you don't like to sit down, you're full of ideas, your attention scatters across a wide variety of topics, and you're not very stable.
According to Peterson, there are a variety of factors that contribute to ADHD in boys, including genetic and environmental factors. He believes that there is likely a strong genetic component to ADHD, as studies have shown that the condition tends to run in families. Peterson has also suggested that the education system may play a role in the development of ADHD in boys. He has argued that traditional classroom settings, which often involve long periods of sitting still and focusing on academic material, may not be well suited to the needs of many boys, who may benefit from more active and hands-on learning environments.
The schools are not well adapted to boys. I don't think they're particularly well adapted to girls either, by the way, but they're particularly not well adapted to boys. Boys aren't designed to sit still and be bored out of their skulls for 7 hours a day. And there are boys with particular temperaments who are even less inclined to be able to do that. So, for example, if you're extroverted, highly social, possessed by a fair bit of enthusiasm and positive emotion, then you're going to appear more hyperactive. If you're creative, then Your attention is going to be fragmented in some sense by the multiplicity of your interests. So if you're creative and extroverted, then you have both of those working against you in terms of your quiescent adaptation to the school environment. Temperamental variation is also much more common among boys. Panksepp showed, same guy with rats, that if you deprive young rats of rough and tumble play, which is what the young boys are deprived of in school, let's say, that they get hyperactive, and then their prefrontal cortexes don't develop very well because they're not having the right kind of experiences, and that you can treat that quite effectively with psychomotor stimulants like Ritalin. So that's kind of an interesting bit of scientific information that no one pays any attention to. There is also absolutely no evidence whatsoever that long-term use of psychomotor stimulants produces increases in cognitive gain. Zero. And there's plenty of evidence that it's harmful. Then the second part of that was, what about adjustments for, in the academic world, say? That would be disability adjustments. It's like, that's such a rat's nest that I don't want to even discuss it.
Dr. Jordan Peterson said, "It's not really a wonder that many children are afflicted with ADHD. What is a wonder is that not every child is not diagnosed with ADHD. Every kid has trouble with curbing the wiggles, paying attention, or controlling impulses. For some, however, the problems are so pervasive and persistent that they substantially limit success in different aspects of their lives. Likely you know someone affected by attention deficit hyperactivity disorder because it's one of the most common chronic childhood disorders. Low in agreeableness conscientiousness, and in high in neuroticism, you're likely to manifest symptoms of ADHD. It's because you're exploratory. You don't like to sit down, you're full of ideas, your attention scatters across a wide variety of topics.
And so one of the things that's happening with boys, because they're way more dosed with attention deficit disorder medication than girls, is that their natural proclivity to engage in robust and troublesome active play isn't appropriate for a school environment where you're just supposed to sit down and shut up, and so the kids get hyperactive. And instead of letting them out to run around until they fall over half exhausted, which is exactly what you should do, you medicate them so that their exploratory systems, which are the activity of which is facilitated by the dopaminergic agonist, that's the ADHD medication, suppresses the play function. It's absolutely appalling. There's no excuse for it. But it's a good indictment of the education system, because why in the world would you take 6-year-old kids and get them to sit without moving for 5 hours? Unless you want them to grow up fat and stupid, why in the world would you train them to do that? Well, it's easier. That's one thing. And when they're sitting there, there's nothing disruptive about the rough and tumble play, and that can be quite, play. Anyways, Panksepp figured out that rats play, and not only that they play fair, and they seem to enjoy it. He also figured out, this was really cool too, that if you give juvenile rats attention deficit disorder drugs, Ritalin suppresses play. So that's worth thinking about. It's like, well, why do you have to give juvenile human beings amphetamines in school? Well, because they need to play. Well, they don't get to play. They don't get to wrestle around. I mean, that's oppression as far as I can tell. They don't get to wrestle around. That's fine. Feed them some amphetamines, man. That'll shut down the old play circuits. Well, here's the other problem, is Panksepp found out that if you don't let juvenile male rats play, their prefrontal cortexes don't develop properly. Surprise, surprise, you're not letting them mature. It's like, what else would you expect? So, that's something to think about really hard.
ADHD is a complex disorder, and its exact causes are not yet fully understood. However, it is believed to result from a combination of genetic, environmental, and neurological factors. Diagnosis of ADHD involves a comprehensive evaluation, which may include medical, psychological, and educational assessments. Treatment typically involves a combination of medication, behavioral therapy, and lifestyle changes. If you found this video informative, be sure to subscribe to our channel to stay updated, and don't forget to hit the bell icon for more timely updates. Hope to see you again soon.